We are live. It's Friday at the Dry Eye Foundation. That took a little longer than usual, but it always works out in the end. So my name's Aiden, and this is Rebecca from the Dry Eye Foundation.
Hey, everybody.
All right, I just wanted to get it started today and go over our upcoming events. Rebecca, you've got a group this afternoon at 3 Pacific. That's the Incomplete Lid Closure group.
Yeah, that's everybody from Bell's palsy to acoustic neuroma to anybody whose lids don't close. Plus, this week, possibly also a catch-all for people with dry eye that don't have lid closure issues, just that aren't able to make any of the other meetings. So anyway, whoever you are, very welcome to join the group at 3 today.
Sounds good. I think I referred one person to the group who had like incomplete lid closure at night, lack of thalamus and some autoimmune stuff. So maybe you will see that person as well. Let's see. I had a millennials group on Tuesday, met a new member. It's always nice to talk to new people and get them plugged into the foundation's programs. So that was certainly an interesting meeting, and just happy that we're making it to every meeting with at least a few people. Sometimes it's a little scary before the meeting, like, is anyone actually going to show up? And let's see, I didn't hear from Ruth about her UK group yesterday after she wrapped up. It looks like one person was registered. I don't know how that went, but hopefully it went well. And then next week, it's going to be a short week for us. Rebecca's got 2 Zoom groups. She's leading the mental health Zoom group on Monday at 10 a.m. Pacific, and then the recurrent corneal erosion group at 4 p.m. Pacific on Tuesday. So
it's going to be a crammed week because we leave Wednesday morning for American Academy of Optometry.
Let's see, and I'm just putting our calendar link in the YouTube chat if I can think and type at the same time. So dryeyefoundation.org/calendar, you can see our events that way. So let's see, I'll turn my screen sharing off. Aside from the millennials group, I just wanted to share working on a new fundraising campaign to just kind of close our budget gap for this year. I've got a good idea of what our expenses are going to be and how much we need to raise. So look out for an email pretty soon about just end of the year fundraising. And also we're really excited to look forward to the helpline kind of expanding in 2023. So we have a small goal for the end of the year, and I think in excess of that, we'll be stocking away some money for helpline next year, looking at, making a hire and just getting some more funding. So it's nice. I've been thinking about our fundraising this whole week and finally got a chance to put some time into it today. So we'll review that in a little bit, and I'll get an email out there soon. Just trying to think what else. Can I talk about the press release? For next week? Yeah, so Rebecca submitted an application for really a new product spotlight at the optometry annual meeting next week. And we chose to kind of highlight the helpline as the product, as it were. So we worked together, was it Wednesday, sending them a press release that'll go along with the press conference on Tuesday. So I guess I know our in-person dates for the annual meeting, but I guess Tuesday is their press conference. Did you record a video for that as well?
Yeah.
Cool. Yeah. So.
Yeah, that was the main part of it. They have like 5-minute video slots for everyone. And I know companies put together fancy videos for those things. And I just switched on the camera and talked, which is kind of what I do, but it was a lot of fun. And it was kind of cool to see it on the list of things, to just see this kind of sandwiched between, pharmaceutical companies that are all folks we know. So just fun to get a little bit of new visibility for it. And yeah,
we'll see where that leads. We put a little fundraising pitch for the helpline in there, and I don't know what the audience makeup is going to be, but hopefully the word gets out there to doctors that the helpline is a resource.
Yeah. I think American Academy of Optometry is a smaller venue in terms of the exhibit hall than ophthalmology, and dry eye is more bread and butter in optometry than it is in ophthalmology too. So I think we're gonna have a lot of interest there. Honestly, I think it's going to be fun, and I think we're all going to be very, very busy a couple days next week.
Speaking of, I don't know if we plan to talk about the optometry meeting next week. Is that because we haven't really planned for it yet.
Plan to talk about what?
Oh, today, I just
Okay.
didn't even see it on the
Oh, I
thing.
wasn't thinking about it. I was just jotting down thoughts on our thing for stuff that was on my mind, but yeah, that should have been in.
No, I
Yeah.
wasn't thinking about it either. And I was just thinking, well, yeah, it's because we sort of have the details figured out, but we're kind of last minute. We'll figure it out. We'll figure out our flights. I know we have everything on the calendar, but yeah, so we're going to be
What
gone
I want to
Wednesday to
know is,
Friday. Yeah,
what I want to know is, do we have enough stickers?
we have enough stickers. Yes, yeah.
We had some really fun stickers that we were handing out at the ophthalmology meeting.
I couldn't even bring myself to unpack that suitcase from the ophthalmology meeting. It's just sitting in there. I was like, everything, candy's not going to go bad. It'll be fine.
Yeah, Halloween candy, that's the real draw. Although since we're closer to Halloween now, probably more people will be handing that out too.
Yeah, that was a hard one at the last show, having a bucket of candy next to me for 3 days. I could not resist.
I ate more of that than I want to do for sure.
All right. Okay. Well, back to the regular scheduled program. What do we have?
Right. So this morning I was in here at 7 for this program. So it was a few hours meeting. It was the second in a series of meetings in this program called Voice of the Patient, where it's a Novartis thing where they're bringing together some patient advocates or representatives or leads from different organizations in a whole bunch of different areas of healthcare and putting our heads together on a number of interesting advocacy topics. And I've been in working groups of various sorts before, both for Novartis and elsewhere, but they've always been, or pretty much almost always been, dry eye related, right? This is much broader. And there's another person in the group with me that has dry eye. But everybody else, there's things like MS and breast cancer and other stuff. And it's just been fascinating, very enriching conversations, and making friends with people in there that I want to get together with afterwards. Just some of the ideas that are being kicked around. So a lot of the things that we struggle with in our disease area are not unique to us and this particular problem, right? So there's just real power in those conversations about things people struggle with and things that would help. So I'll share more when we get close to the end of that program too. So speaking of advocacy, it's just something I've been thinking a lot about this week on various fronts is the power that we all have, every one of us as individuals, to make a difference in things. And there's times in life where we're scrambling to get our needs met and have no thought of what we can do to reach out and make a difference on something. But there's other times in life where we want to make a difference and don't know how. And so been just thinking more of ways we can put opportunities out there for people, but also just on the visualizing, does my voice matter? I mean, you can feel pretty small in the midst of these big industries and healthcare systems that just seem very impersonal at times. As I was just kind of going down that thought stream at some point this morning, I was thinking about how strongly aware I feel lately about both positives and negatives in our eye care space, and the negative things we're struggling with, but also the positives and the reasons for hope. We've got this drug pipeline that's just amazing. We've got potentially up to 4 brand new drugs coming on the market by the end of next year. We've never been in a place like that. We've got, I think I may have mentioned this before, can't get into details yet, but a huge new research funding effort out there in the neuropathic pain space that there will be news on eventually, that I'm tremendously excited about, because this has never happened before. And neuropathic corneal pain is an area where we do feel very overlooked and like no one cares enough about it, and there's far too few resources. So I love seeing new hope in that area. I was talking with a company recently that's working really hard to try and get insurance coverage for, yes, drum roll, some kind of in-office MGD treatment, right? Which are the notorious cash hogs in the dry eye space, is all this MGD stuff that you got to pay out of pocket. So hearing from a company that's dedicated to making a difference, to changing that reality, that was an encouraging thing to me. But there's other areas that I have felt personal discouragement in recent months and weeks, really, where I always want to funnel that discouragement into, what can I do? What can we do differently? How can we change that reality? And I just want to dig into those just a little bit today. These are not things that I've never mentioned before, but I just want to dig a little bit further. One of these is LASIK, and sorry, let me turn off my notifications. I must have turned it off just for an hour. There we go. This is how I got started with eyeball stuff, right? Was when I had LASIK back in 2001. So it's something I'm very acutely aware of, is the numbers of people in our community that were harmed in some way by LASIK. I had a long conversation with someone this week, not for the first time, with this individual, where, 4 years in her case, and it was somebody pretty young, of just massive life impact, just turned life upside down with severe ongoing pain, the kind of pain that, when it gets better, the memories, the trauma of that experience remains and lurks there as a fear. Could this recur at some point? Just a hard place. Anyway, so way back in the day when these sorts of problems were first starting to happen and they weren't recognized, we didn't even have names for them. People just went through these experiences. Eventually, enough people were making noise about this that the FDA put together a public hearing in 2008 where people could come and share their concerns, and if they wanted some kind of changes, they could advocate in that meeting for the changes that they wanted. There's videos up there still on YouTube somewhere. All of the talks that people gave were recorded, including mine. This is 14 years ago. So we all came and we talked and we explained our concerns and we asked for help and we asked for change. And then 14 years went by, right? And finally, this past summer, the FDA created a proposal, which they made public, to modify the labeling for patients on these lasers that are used to do LASIK. And it's a whole lot of pages of stuff to read. I think, do you have the link to the actual PDF thing?
Sure, yes,
Okay.
send the link, yeah.
That would be great. It's nice that they've done something. It's not nice that it took 14 years. And what they've done is not enough. Certainly not for those of us that have chronic pain. And some people are far more disabled by that, just have far higher levels of pain than I've ever experienced with it. That issue is not sufficiently addressed in this step that they're taking. I do want to acknowledge it's an important step. I think what they're doing, even if to us patients it doesn't look like anywhere near enough, it sends a message out there to industry. It will be in the news more when it gets finalized. It's at least getting that message out there more and more, that there are issues for people to be concerned about, but it's still nowhere near enough. What I want to get at today is they are accepting public feedback on this until sometime in November, and they need to hear from all of us who are concerned about LASIK. They really do. I have to say, it's October now, and this thing came out in July. And the reason that I haven't brought this up more in our community is honestly, it's at a personal level, it's an emotional thing for me. It's upsetting. I've been avoiding it, but now we're coming down to a deadline and we really need to get the feedback out there. So I finally went and looked more closely online, and I looked at where they're accepting feedback, and I read through some of the entries, and I just kind of had to hold my stomach and walk away, because it was clear to me that there are people soliciting from the nature of some of the entries. I think that doctors are pushing people to go and report their excellent results and what a great thing LASIK is there. And that is not the place for it. When we're talking about labeling, about warnings for things, this is not the time to be doing rah, rah, what a wonderful thing LASIK is. It's a place for people who have been harmed to say, here is how you can more effectively warn other people about what can happen. So it is really important that our community, to the extent you've been impacted or someone in your life has been impacted negatively by LASIK, we've got to get out there and make our voices heard. All you have to do is go to this page. It's got a link for it. You type in your comments and you hit go, and it will add them. They will be public record, but we got to get our voices out there and make them heard. I haven't even filed my own yet, but I'm sure going to. I'll be getting an email notification out on our mailing list shortly about this as well. I'll be getting the message out on social media. I just had to kind of find a way to first embrace the topic. Like I said, it's a touchy one for me, but it's one that's just got to be talked about and addressed. So please go put your comments into the FDA. Even if it's simply you've been part of the dry eye community for 1 year, 5 years, 10 years, whatever, you've been part of a Facebook group or something, and you didn't have LASIK, but you've seen what other people are going through just by interacting with them in your Facebook groups, your support groups, you can share that as well. They need to hear from us. So that's one area where I just really want to challenge people to step up and write up those 2 or 3 sentences or paragraphs, press send, and get that information in. Second area is what I will keep referring back to until it is completely dealt with, and that is biologic eye drops. I won't go on at length today, but this is a serious problem, regardless of how you feel about one individual drug. For purposes of today's conversation, I don't care about who's using Regenerize, who's not using it, etc. I just want to say it is not acceptable for companies to go around lying to us patients all over the country about the FDA approval status of a drug that they're selling. It is not okay for them to look our doctors in the eye and lie to them about the FDA approval status of a drug. Whatever you think of the drug, it's not okay for companies to lie about it. We cannot make informed decisions about risks and benefits of treatments when we are being lied to. This is not a question of exaggeration. It's not a question of over-enthusiastic salespeople. It is a question of straight, outright lying about something very fundamental. When somebody tells you that a drug has been FDA approved or has an FDA approved indication for something, I don't care what that thing is, any FDA approved indication, that means a lot of very specific things, like that drug having gone through years of human clinical trials to make sure that it is safe, at least for something. It means that it's gone through scrutiny. It means it's gone through some oversight. It means there is some kind of basis for claims that are being made. That is not true for Regenerize. It has not been through that process. So I don't care what form of squirrely language is being used to suggest that it is FDA approved. It is not. And people need to know that. And people, both doctors and patients, need to hold companies responsible when they are lying. So if you haven't gotten this message kind of loud and clear that we need to speak up, I just want to urge everybody watching today, speak up about this. These are not behaviors that we should be accepting from industry. Your voice matters. If you say to your doctor, I am concerned about this thing, it makes a difference to your doctor. If you get on the phone with the FDA or shoot them an email, we have really easy ways to get in touch with the FDA on the website, biologiceyedrops.org. It matters. You might feel like it's going into a black hole, but it isn't. The steps that the FDA have already taken and are taking and will take are prompted by the numbers of people that are contacting them about this issue. So if you haven't added your voice, please do. Can you put the FDA phone number in the
Oh, okay, yeah.
there? And is it the OCOD email address? So that's my challenge to everybody today. A 5-minute thing, a 1-minute thing, a something to make your voice heard. Because we all get to do that, and our voices are needed. Our voices are more powerful than we think they are.
Just taking a look at biologic eye drops here. We talked earlier this week about just a blog post. What Regenerize says,
Yes.
what the FDA listing actually says, the Daily Med listing. Yeah.
So the pivot that they're taking in their marketing now is some doctors are saying now, yes, it's OTC or over the counter, but you can't use the words OTC and FDA approved in the same sentence, because over the counter by definition is something that the FDA has not even reviewed, let alone approved. You can upload your listings to the FDA and nobody even looks at that. There's no approval process for it. So I will have a blog post out there just showing FDA, any OTC listing. You can look up drugs at Daily Med and there we go.
Yeah. So FDA has not evaluated.
There is just no way. And right above that, OTC drugs are not reviewed and approved. That you cannot equate that with FDA approved. If you are being told that Regenerize is FDA approved, you are being misinformed. The person saying it to you may have been misinformed by someone else, but you need to know you're being misinformed, and you need to give that feedback to whoever is telling you. And I just brought up the website. So I'm looking at, actually, we have kind of a fun picture on the homepage of biologiceyedrops.org right now. So I was having this conversation with Ben, a member of our community who's done some like IT consulting work and things for us. He's had dry eye for a really long time. I don't remember how. There we go. We're having this conversation and I'm updating him on what's going on with biologic eye drops in general, not just Regenerize. There's other eye drops out there similarly. And he was telling me about how amazing it is to him. He made some baklava recently, his grandma's recipe. He's got a great grandma, and everybody's saying, oh, this is just the awesomest stuff. You really should sell it. And just out of interest, he looked up to see what would it take to sell my baklava, like to friends or at a farmer's market or something. And he looked at all the pretty daunting list of requirements and noted also that somebody would have to come and inspect his oven. And he's like, okay, I can't sell my baklava without being inspected by somebody or other. But people who are making stuff that we're all putting in our eyes can do that without an FDA inspection? How does this work? Anyway, that tickled my fancy and we ended up putting it on the site. It should give us all pause that it is possible to distribute drugs for our eyes without any scrutiny or oversight by the FDA. That's concerning. All right, what else do we have, Aiden? Moving on from here. You talked fundraising, you talked events. I'm really looking for, wow, it's only 2 hours away now. We've got a group coming. So if you, looking forward to it.
I think that's it. Yeah. Yep. Let me just see if people are registered. Anyways.
And we're not going to have Dry Foundation Live next week, right? Because we're going to be right in the middle of Academy.
Exactly.
We'll be back in 2 weeks.
Yep. All right. Nice to talk to everyone, or nice to talk at everyone. Bye.